like to share our experience in Astana Medical University and how we face the problem to comply to the request of the ministries. I'm not talking only about the Ministry of Education, but also about the Ministry of Health and the Ministry of Finance, and how we could involve innovation and the reorganization of our structure in the university to be more functional to these goals. So, of course, we started from where the Kazakh government wants to go, where the Prime Minister is asking to go, and all the ministries are going. And they are going through roadmaps, PRICAs, they are going through KPIs they gave to the universities, and they are different from each ministry. Then we fuse this with all the projects that are going around us and our ideas and our technologies. And we fuse this with our internal data through a business intelligence system. And this is how we are processing our structure inside. And we develop first through a new office for strategic development, a strategic plan. We actually start from scratch. And the new chairman of board of directors and myself arrived only the 1st of July. And there was a deadline for the end of July to give the strategic plan. So we asked to postpone our strategic plan, and we start everything from scratch. How we will do, when we finish the strategic plan, as we did, we start to work on our management control system. Management control system is how you bring where you want to go in practice. You start to implement it. And you implement it through balanced scorecard system that we are putting in place now, and through KPIs that we give to each cátedra, and we'll see also about clusters. After this, we of course monitor the system so that we can correct and check our data and correct our strategic plan. This is how we are working. I have to say that the first thing we have done, we create 4 main new offices that were not in place in Astana Medical University. One is the Office for Strategic Development. Another one is about management control system, as you see in the chart is there. Another one is business intelligence. Without this we didn't have any data about the university. And I want to say also about policy, internal policy, and project and technology assessment. We create an office for these 3 functions together. And they are all shown in the map, their functions and the integration. So these are all the roadmaps that we had to read, study, and some of them are very long. And most of them are also in Kazakh, so not everybody from Kazakhstan speaks Kazakh. That makes it even more difficult. But these are all our evidence, where the ministries want to go. And these are some of our KPIs as university. These are the most difficult for us. We have a return on assets set as 5%. At the moment we have 0.2. We have the increase of income from science. It was set at 5, and we have 0.3. And now they move it to 15%. So we have to jump from 0.3 to 15% of our income from research. But we check our employee, and we didn't have researchers. We only had employee for education, for administrative staff, and other. Other usually is like maintenance, cleaning, and so on. So who was going to do the research? We didn't have any researchers. So, but we have also other very difficult indicators. And I know that probably in Karaganda they know as well, because they are the same indicator for all the universities in Kazakhstan. And I'm just showing to the other people, maybe from abroad, the difficulties that we had to face, and we will have to face. And for example, we have the number of teaching staff that's passed the IELTS test or the TOEFL. While in our university, the percent of people, English-speaking people, it's very, very low. We are below 5. So, and now it's changed. So of course there are easy ways to do. You fire people, you hire new people, you get to the point. But I promise, as a strategic development executive director, to do not fire anybody and do not cut salaries. So that's a big challenge, because you need to reconvert people from one function to a different one. Of course, they are facing all different type of areas, and you can see here different ones, even about clinical activity. We have to have an income from clinical activity of 5%, but we don't have a hospital, and that's a greater problem. So the problem is, shall we get a hospital and then get all these indicators that we will not reach, or maybe we just avoid the hospital, and so we avoid the KPIs. So, but this is just to have a look. These instead, the previous one were Ministry of Health indicators, and these are Ministry of Education indicators, where they are talking about involving foreigners, people in top management of the university to bring innovation. But we talk about increasing the number of foreign students in our universities, and so on. And of course, these are very difficult as well, as you can see. So, let's go back. We start from all the documents that you have seen, and we highlight, summarize them in 36 directions. There's not so few. We have 136 wishes, and of course, not everything was asked to us, but we thought that we should try to comply as much as possible to what the ministries are doing. For example, the Ministry of Finance is asking to create hubs and incubators and technoparks, and Ministry of Education as well. Some of them are combined. That's why at the total, at the end, we have 136 different drivers. We call these drivers. Then we start from our internal data, and we were trying to solve the problem because, you know, it's a bit like going to the moon with a small cart. So the first things we have done is to define a strategy. The strategy is not a strategic plan. They are two different things. After the strategy, we define our strategic plan. From our strategic plan, we try to combine, based on the ministry approval, the general directions that we have two at the moment. With from this, we have several goals, and that are 3 main goals with 13 tasks, and this ends up with an operative plan that we are closing now, because we had the approval of our strategic plan by the board of directors and the ministry just a week ago. To 210 actions, 210 things to do, from writing a book, for example, on evidence base of nursing, to creating a course on anti-corruption, to create an incubator or change the entire structure of the university. So they can go from maybe easy to very difficult levels. But in total, we have 210 actions to do in the next 3-5 years. So what I want to focus is not on about 210 actions, because you will fall asleep, but on the main 4 enablers. We found out what they were the 4 actions that will permit us to reach the 210 actions, the real ones. So we studied enablers, and these are our enablers. The first one is to create an incubator. It's difficult that today we measure research in 2 ways: articles, and we have of course some KPIs. And the second one is creating spin-offs. That's another way to measure research, applied research. So we decided to focus on an incubator. We review our internal structure with creating functional clusters, and we will go through that later. We work to reorganize the educational progress, especially public health system and educations, because our university chose 3 main directions for excellence. One is public health, one is anesthesiology, and one is neurology. And the 4th one is to tackle the problem that we don't have a clinical activity at the moment. We are based in all the hospitals in the city, but we don't have our clinic at the moment. So these are the 4 enablers. Without this, we can actually do not really reach these 210 actions. But I'm glad to say that we started with the incubator, and we work on the incubator. In incubator, you can see that it's working with startups and spin-offs. We create a technopark, an internal technopark. We are signing, I hope soon, with other universities like Nazarbayev University, but also Eurasian National University that are they have a technopark, to have without border technoparks, so people can move and share ideas with our technoparks. We open our incubator. We'll create lessons like for acceleration of ideas, but at the same time also support for developing our entrepreneur inside the university or outside the university. And we will support them also developing the patents if they have good ideas as well. And I'm glad to say that from the 1st of July, in the 24th of August, we inaugurate our incubator. And we have at the moment several, actually maybe too many requests to be incubating in our incubator. So we are assessing them properly to do not fail, to choose the best opportunities. But I can tell you that in around 10 days, we are opening the first spin-off. This is the organization of our university. And we saw that all the structure was based on education. The structure was undergraduate, postgraduate, and long life learning, or other type of postgraduate. With this structure, we have a lot of duplications, and nobody was working on research. And there was no integration. Each one was working as silos. So we reorganized. As you see, we have colors. The colors are horizontal. You have to read horizontal. The first column is the deans. And the deans run the educational process as before. We didn't want to touch the educational process because it was working fine. We didn't want to destroy anything. We remember from medicine, the first rule is do not harm. So we start from that, do not harm. So, but as you see, we fuse different colors, and white one is administrative. We fuse them together in clusters. And while the education is under the dean's responsibility, the verticals are under the vice directors. They work for research, clinical activity, and consultancy to other companies or at the university to produce money, because we have to increase the income. So this is how we reorganize. We reorganize in functional clusters. Functional cluster means that we collect all the cathedra, depending where they were teaching, postgraduate or undergraduate, administrative together. This way we create our research center, we create our incubator, we create a cluster like maternal and child cluster, or neurological and psychological clusters together, and so on. This will permit us to apply to projects like European project, because we have the right cluster to participate, like we are going to participate in some of these tenders. And this is very important because we actually discuss it with all the cathedra. First we discuss it with informal with the board, of executive board. They approved the idea. Then we went to talk with each single cathedra. Each single cathedra. At the end of the meeting, they were all happy to create this new structure about cluster. See, the cluster is not only about functions, it's also about autonomy that we are talking about today. Because a functional cluster, thanks to the incubator, can spin off tomorrow, creating a private-public partnerships. And that's another thing that ministries want. Especially the Prime Minister is asking for this. And they're asking also to create a structure to work on project management system. And this structure can work on project management system. So that's why we're changing it. We had a request, explain us exactly how you're doing, so we do it right away. Actually, we're trying to do it, the pilot study first, to see if it works. Maybe it doesn't work. Just give us a couple of months and see how it goes before you start to change your structure. Let's us be your mouse on the testing laboratory. So, but the important thing is that we are working for autonomy. We are ready to be autonomous. At the moment, each single cluster will work for their money. If they find a project, they have an income, those income do not go to the rector, it goes straight to the clusters. And this motivates people. That's another subject, is about motivation of the students. That's why I'm saying that we have to work on the strategy, not on the actions. Because the strategy is where you find the common enablers that activate a lot of other actions and permit them to reach them. So, as you see, we also split some cathedra in more areas, because public health was transversal. We create 5 profiles, from health management, to hygiene, to preventive medicine, to literature, like meta-analysis and systematic review, and primary care, where we're going to invest a lot, as you see in the next step. But the important thing is that this structure was approved by all the cathedra. When we brought it to the ministry, they approved it as well. When the board of directors, most of the universities do not have a board of directors at the moment, when an independent director start to complain, directors stand up and defend the situation, say, we need this change. So it's not top down, it's bottom up. And this is very important because that means that this will become a reality. It's not papers. That's why we spend so much time in writing the strategy, because this strategy will become true. As you see, the board of the executive board approved it now, so our board is final. This is the last one. There are some names changed, but the structure is the same. And we did not cut one single cathedra. I want to focus this because when a new director comes, usually focus on cost and start to cut. Cut heads, cut departments, cut money, cut expenses. We are not doing this. Very important. So, another enabler is the reorganization of the educational program, and this is how we are structuring. This comes from Khan Academy. And we are working on a sort of model from e-learning. That's why I was very interested from the presentation of New Zealand, because, and some other from yesterday from Oxford and so on, because I believe that we should reorganize our face-to-face learning based on the e-learning, because it's more functional. Today, public health, some other faculty have the same things. We have 40% of mandatory subject and 60% elective. But the elective are not chosen by the students, are chosen by the deans. They can get maybe extra money for choosing a professor instead of another one. So what we have done, we increased the number of electives to an exponential numbers. Now we have a huge amount of elective subjects and people can choose their own pathway. At the end, we will not produce a specialty in public health. We will produce thousands of different diamonds, different specialists that are focused and specialized in a specific way. So each one is different from the other one. And the companies can hire the one that they fit most on their situation. Involving in the educational process the company that will come and teach from Kazakhstan and from abroad. And the funny thing is that all these measures that we've done, we didn't spend one tenge. So there is no excuse. Nobody can say we don't have money. We are doing all this without money. Of course, we are asking our network to collaborate with us to renew the system and to be involved in the future of our system. So any of you from this floor can propose subject. No, I'm not talking about only the first lines where they're coming from abroad. I'm talking the further lines behind where Karaganda can propose some subject and we will accept it. If the students choose your subject, and the subject can be in Russian, Kazakh or English, creating a mix of teachers so they can learn the same subject, then if they choose your subject, next year we will pay you instead of somebody else. So some of the professors were afraid. What now? What now? You're cutting our hours, or you're cutting our salaries. I said, no, we're not cutting anything. I'm giving you time to make better lessons this year and to invest in research. Sound weird to them, but they were happy. So we actually opened an internal market. And I'm proud to say that this already happened. I'm there since 2 months and we reorganized the public health first year of public health, and this year our student could choose all the subjects. And you can still propose your subject because we put all the mandatory in the first semester, giving the opportunity for the electives in the second semester. So actually we already had 3 enablers over 4. Let's talk about the 4th one. This is a very tricky area, is the clinical activity. You know that some of the universities do not have a hospital. So what we said, okay, creating a new hospital is against what the Ministry of Health is saying, so we cannot create a new hospital. So, shall we take a hospital? That was the main idea at the moment. But the point is there is a big fight between Akimats, that they own the hospitals, and the university and the Ministry of Health, because they are under 2 different ministries. One is Minister of Interns, one is Minister of Health. So there is a fight. So we say, we don't want to fight anybody. We don't want to fight to own our hospital. We don't want it. We can rent it. we rent a piece of the hospital. The worst word that you have, there are always in some hospitals some wards that are losing money. We'll take that and we will start from that. We will rent it to you. So we went to private clinics, we went to the public hospital asking, can we rent a piece of your hospital? And they said, yes, it's possible, because the ministries are saying that it's possible, but it's not possible. So it's possible or not possible? The answer is not clear. And I explain to you now why it's not clear. It's not clear because our professors are going to work in the hospitals. And we pay them to work there. But let's see the business model. The business model is how the money go around. And when you understand this, you understand a lot of things. At the moment a patient goes to the hospital, is treated, he goes home, and the government pays the DRG. DRG is money that pays the cost. 80% of the cost is employee. But the employee are coming from the university. So we are paying the employee, and we are not taking money. So the hospital actually is very rich. They produce, they get money, they don't have costs. Very happy. So that's why it's difficult to ask if they can rent it. Because if they rent it, then we have to take the DRG. So our human resources produce money for themselves, not for the hospital. So that's why it's possible, but it's not possible. So at the moment, of course, we have two options: renting or getting a hospital. Actually, there is a Prime Minister letter that's sent to all universities, to Kazakhstan as well, that each university will have, medical university will have a hospital. It can be on owned system or trusted system, but we will have one hospital. But what we will do, we don't want the hospital. We will rent to our spin-offs, so they can produce money for themselves. We don't want money. Plus, the other idea is to develop a hospital without beds. That's called home care around the world, where the United States is investing a lot of money. And we want to do this, especially for the rural areas. We don't want the big market in Astana or in Almaty. We want the poor market in the rural areas. That's where we are going. We are going for the social activity. That's very important. We have also now starting a new e-learning platform for rural areas for free. We will teach to all the rural areas citizens of Kazakhstan and disabled people in jail for free. So money is not what we are looking for. We don't want them. Money usually creates problems, while knowledge do not create problems, it creates opportunities. So our idea is to develop a system through an e-learning platform of education of public health and home care and the telemedicine to develop a connection with pharmacy, nurses, and general practitioners to give a new model of primary care in Kazakhstan, so that we can show a different model that works in rural areas. Well, these are our dreams. We are working for that. In 2 months, we got 3 or 4 enablers. We try to get our 4th enablers maybe for January or February, maybe before. And I can say that we are waiting our spin-offs before Christmas. And hope that you will follow us and maybe cheer for us and give us счастливо. Спасибо большое.